Okay, we are on the last leg of what has been an incredible day. Each of the presentations, in my view, have been a 10 out of 10, and I think our remaining presenters will, I'm sure, provide us the same top score. It's been an incredible journey. My name is Valerie Frunchak. I'm an Associate Nursing Director at the Jewish General Hospital. I do many things. One of my clinical areas of responsibility is mental health, and I cannot tell you how much we need to engage patients and listen to the patient experience in the area of mental health, which touches, I would say, everybody in this room. If you look at the scope of your families, friends, relatives, and acquaintances. We don't talk about it at this conference today, but there is a tremendous amount of work to be done in that area. It has been a pleasure to be on the planning committee, and it has been very exciting to be able to listen to wonderful advances today. I would say this is a hopeful healthcare conference. We're seeing many examples of wonderful creative opportunities today. There's been many impressive initiatives, and we can come away optimistic. But we also see the risks that these projects may remain localized, precarious, and fail to spread and achieve system-wide impact. The province of Saskatchewan has taken bold steps to make its health system truly patient-centric and has important lessons for other provinces. Dan Florizone has held senior positions in the health sector in Saskatchewan, including 5 years as Deputy Minister of Health between 2008 and 2013. Then he moved over to education. He engaged the Patient First Review, which asked residents how they thought health services should be improved. He was an early proponent of the lean philosophy to improve efficiency and was chair of the Health Quality Council, which really led the way in supporting evidence-based, patient-centered care. Please join me in welcoming Dan Florizone.
Okay, everyone's aware it's Friday, right? So probably the important and first consideration is, what the hell are you doing here, right? Actually, it's a great reflection of the topic, the passion, and the area. I think there's a good reason why you're here. We've got this real opportunity. Now, I'm going to use some language. You have to actually excuse me. I'm going to call this a movement. That means different things in health than it does in education, but remember, we're part of a movement, okay? We are doing some great work, and you've gathered the right players, the right people, the right kind of passion and excitement. It is an absolute privilege to be here. I've never been on a program as a former anything. And usually I never knew what happened to former deputies of health. I just knew they went away. I assumed that there would be an asylum or something, right? Where they're all huddled together, regretting that they didn't do more. You know, comparing notes. How did it go for you? Not so well. Yeah. But it's an absolute privilege, and I've been involved in the quality movement. I continue to be involved government-wide in the province of Saskatchewan. I have, in fact, in a couple weeks' time, a great privilege to present to deputy ministers right across the federal system. And my message to them will be, hopefully, very consistent with my message to you today. We need to focus on those we serve. So whether it's patient first, and that spirit of patient first that we launched 5 years ago in Saskatchewan, or student first, which we launched last year. By the way, I'm highly predictable, right? So I'm going to give you a sense of where things are at. I was reflecting on whether, let's say this didn't happen, this forum, and in fact this movement was never started. I can tell you it's going to happen anyway. I can tell you that because the students I'm responsible for and the children that we've all raised, maybe even grandchildren, we have trained them well. Do you think they'll be the same as our parents? Passive in the care journey, or that we're going to be passive, even the baby boomers, right? We're going to have questions. We're going to demand something different of the health system, and in fact of every sector. Now, the beauty with patient and family-centered care is that this is the spirit of now trying to focus the energies of governments on what they fund and what they directly deliver. And if we can start to look at touch points across continuums, where social services, we heard that today from our friends in the UK and the NHS, where social services, where justice, where a myriad of other programs and human service delivery agencies come together, and we look at the whole of the continuum. You know, what could we do? So we've got some really interesting initiatives around the life cycle of the offender. We've involved those that actually have been through the justice system, have gone through incarceration, and they are saying you need to move upstream of what we're doing. Some of the most important work that I've been involved in is not only launching a Student First initiative, but trying to understand why the sector, with individual professions and areas, continues to say we already are Student First. Does that sound familiar? Okay, you get a bit of that? And you know, to be fair to them, I think they're right. But it's insufficient in a system just to have individuals optimizing. You know, that's often referred to as sub-optimization. Just because you are doesn't mean the system is, because you're caught as a cog in a bigger machine. We have a leadership imperative, and it starts at the policy arena. It moves all the way through cascading, and that's why I love the framework that's emerged here. If it doesn't hit the ground, if it doesn't make a difference to providers on the ground and patients at direct point of care delivery, then is it really an improvement? Or at least is it an improvement that we're seeking? You know, is it the most important thing? We've got to get alignment because, not because policy and governance are the most important factor, it's because they can either promote or abruptly stop any good initiative that's underway. They get distracted. They need the discipline to stick to it, to be able to focus. So here's one thing that's really interesting out of our Student First piece. Let me just reflect on the patient first piece. The two top priorities that patients expressed to us in that first round 5 years ago, and this is in need of a refresh. Any idea what the two top priorities were? That's okay, it's not up there. Oh, yeah, no, this is a blind presentation. Yeah, actually, it's double blind. I can't see anything here either. So, yeah, I'm from government. You realize that, right? So, yeah. Did I mention I'm former deputy? Actually, Heather was right, but Heather, you kind of cheated, didn't you? You were part of this. No, just kidding. So it was access, but it was also relationships. So we went to students and parents and asked them, what are the problems with the education system, K to 12? What did they say? Relationships. They took it a step further. They said engagement. And that's actually what patients were telling us as well. We've got a problem in the public service, in those services that we're either funding or delivering directly through government, in that this is an awakening. It's an awakening that we've got to focus in on those we serve and look at improvement from their perspective. I've been through years as a CEO, and I can tell you the cost-cutting initiatives that I took in the past, the efficiency initiatives that I've took in the past have been wrong-headed. They've been wrong. Because the way I looked at it is the bottom line. Get the dollars down, but balance the budget. The way to look at it today is enhance value for those we serve, and whatever's non-value added or waste, that's what we root out of the system. It's that notion that if you're looking at a care team and you're looking at the whole of the patient's journey, every touch point, you'll find from those conversations and from that level of engagement with a patient representative on each one of those improvement teams that you're going to have ideas that you never dreamt of. We talk about the benefit to us in terms of that voice, but there's another benefit that we haven't talked about today. and that is that it's changed our discourse. We can no longer be claiming to be the experts in what patients want and need, because the patient is right there. In fact, on the airplane ride up, I was sitting next to a young lady who's a newly minted manager in manufacturing. They happen to be manufacturing Crown Royal whiskey. Listen, you got to learn from whoever you encounter, right? I got 3 hours. Well, poor her, I can tell you, because I want to know all about it. I want to know everything. But I came to the conclusion that she has a disadvantage in that although her staff, in fact, she may be a consumer of her own product, but the biggest link that they have to their ultimate consumers is market data and information. Be the equivalent of briefing notes and briefing information that I create and present. Our advantage in the service sector is the people we're talking about engaging are right there. They're there through the care journey, they're there at those touch points, and in fact, you could almost envision, if I was being really provocative, that we're having conversations about the patient and the patient sitting, either nodding or shaking their head saying, why don't you just ask me, right? Why don't you just engage me? So let's just go through a bit of a thought experiment. What if all of a sudden today, a benevolent gift was given to all of us? The only condition is you have to quit all your jobs, okay? We're no longer going to be involved in the health sector. This benevolent gift under this thought experiment is we're going to be gifted an airline. I won't tell you which airline because I don't want to pick on any particular one, but now we're in charge of an airline. There is a requirement. You've been burdened because I've been assigned as your CEO, okay? You're now the governors, the board, and the shareholders, okay? You own this sucker. I want from you the 3 things that I need to do today and this week. 3 things. We're not going to workshop this. I just want you to throw out ideas. What would you say would be in the top 3 things that you want your CEO to do? We got an airline. Make money? Increase leg room, okay? Safe landing. Wow, that's a... Customer feedback? Okay, just consult the team of... Central place for lost luggage. What else do you want? How do you want me to do this? What's that? How do you want me to do it? Ask the travelers. Do you want me to form a committee? Should I launch a task force? A royal commission. I mean, that's how we roll, right? Get on a plane. Yeah. I'll taste the Crown Royal. Sure, yeah. Well, wait a second. What's wrong with you people? The ideas you're coming up with are different than what we're doing right now. You see, in the health sector, we got it figured. We'll form committees, set up commissions, go out there and call it a thing. We'll do it by taking on initiatives and projects. How come you're running your airline? You guys don't even have any experience of running an airline, but you come up with innovative and creative ways. You told me as a CEO I need to go use that product, right? Go fly. You said talk to the providers. You said engage the customer, try and figure out what their needs and wants are. Plus you had a myriad of other just do it's, right? The legroom thing, there may be some issues with that, but I love it. How about they should no longer be allowed to recline unless it's longer than a 4-hour flight, because more legroom. What I'm getting at here is that we have a tendency within the public sector to use solutions that we've always gone to, use methods by which we engage. We go to the same old. It's only government and government agencies that would form up a committee and end up locking in a structure before you've even had the conversations. If I was the new CEO for you, I'll tell you what, right after this meeting, I'd be out and about. I'd be going, not only flying, but I want to talk to as many customers as we possibly can. Yes, I'll be looking at the data. I'll look at the metrics. I'll look at what we're short of. We'll start collecting things. I'll tell you one thing I won't do is look at last year's data, because I really don't care. I want to know what's going on today, right? So even if it's not research-based data, even if it's quick and dirty, I'll ask the next 20 people what they think. And I will expect of the whole team that we put together on your behalf, because, I mean, I work for you, we're going to have them out there too doing exactly the same thing. The next meeting, you're going to expect me to come back and report to you, tell you what our customers are saying, what our providers of this service have to say about our work. How's it going out there? What's going on? I'll probably look at the environment and make sure that, you know, we're competitive. I'll look at all of that. But I'll tell you what job one is. It's going to be passenger-centered flying. We're going to look at exactly what needs to be done and designed around the passengers. We got a lot of improvement work to do, right? Okay, scenario over, right? I need feedback today. And I need actually that feedback to be implemented next week. Not feedback from last year. All I can do is be critical of last year's data. If I have feedback today, immediate. So here's your challenge. How do you get patient feedback today? Email? Yeah. My email, sure. Yeah, that's right. My email, and as Deputy of Education, that'd be a good thing. You see that thing go round and about. But exactly, give your email, talk to them. How could you do it? Walk the floor, we refer to it in the Japanese term, walk the gemba. Get on the floor, go to where the action is. You know, one place we were to, high performing, right? High tech. We're always a high tech solution. They had 2 fish bowls, and as people would walk out, they'd either put a poker chip in the one that had a smiley face or one that said a sad face. And you look at it and you go, whoa, that's not too complicated. No, we don't like to do that here. I'd rather send a 40-question survey and then wonder why compliance is a problem. I get past the 3rd question and I'm bored, right? The other thing is it never quite gets to what needs to be gotten at. Don't ask me how the service was. Start asking me more probing questions about how good the service could be. So we need to think about this. Feedback today. The reason we have problems is this is a complex sector. We have we have silos, vertical silos. And the more complex the care needs, the more siloed and the more experience of siloed care you encounter. We know that, right? What we don't do very well is horizontal. And here's how you do it. Follow a patient. You want to know what horizontal looks like? Follow a patient. And for those of you that have been patients, you know what I'm talking about. You experience the whole from beginning to end, whatever that experience is. The best leaders, unfortunately, have had to become patients themselves in order to get that aha. You know, you look at them and they say, I just recognized something after 30 years in my occupation as a leader. I got sick, and I can't believe how this thing is strung together. If culture is the way we do things around here, then let's do something different. Let's look at the whole of the experience. Let's look at the touch points. I wish I had more time, but I got to show you a couple videos, okay? Let's do students first. I'll show you something totally outside of your sector, and let's see if you see the parallels.
The way we were doing school wasn't working for our kids, and so We couldn't ask our kids to change, to conform to what we were doing. We need to change how we do school in many cases.
We spent a lot of time over the last few months talking to students, finding out what's important to them, what type of things would work best for them to learn. They talked about technology, they talked about teaching things, and they also talked a lot about the school itself.
I am ready to learn.
We're young, we know we're creative, we know what we want in a school because I guess we're the ones that are going to be in there.
Well, the first thing we want to do is really get the voice of the student in the conversation.
I'm respected.
I think our influence is getting through.
Education's becoming more and more student-led, student-directed. Not that teachers aren't important anymore, but what we provide is different. We need to hear what they need and what they want, and I think we need to give kids more credit for what they're able to do and how they're able to direct their own learning.
I am engaged.
Well, it's pretty cool to be adding my ideas as a student. They're doing a good job of listening to us and putting us first and hearing what we have to say about our ideas.
Lots of the times the teachers actually do get caught up in the curriculum. They start focusing on why are we building this school so we get the right amount of curricular space, when really they should be focusing on how does this space affect our students.
I can achieve.
There's more of a buy-in. I think they feel that they're part of the school. They feel that what they have to tell us as staff, that it's actually being heard and that this is their place. And our whole goal behind this was to make kids want to come to school and not that they have to come to school. We want them to be here. We want them to come every day and be successful in our building.
I am prepared for my future.
When you design it, you're designing a future for more kids instead of just designing their education. You design their future success.
Two minutes, right? Out of the mouths of babes. Many of these young students, for the first time ever in the province of Saskatchewan, were involved in designing 16 schools. And you're going to start to see the emergence of schools. And really, is it a building we're designing? It's a learning environment. It's a redesign and a refocus. These are early days, but what the sector is telling me right now is we're already student first. We've already done all of these things. Well, we haven't done it systemically, and we need to. The last I want to leave you with is a short clip on the voice of patience. And if you look really, really closely, you'll see Heather Thiessen in one of these clips. But I only caught a part of you, Heather. I'm sorry. So if we can cue that one up, please.
The whole concept of how to develop a healthcare facility where you're inviting the community to come in and participate. I've never heard of that till now. And I'll never forget this, ever. I'm thinking to myself, to my grandchildren 10 years down the line, if they're coming through, I helped do that over there. I put the models together, and it's always going to be here with me.
I'm a cancer patient. I've been receiving treatment for 3 years, so I'm really understanding this now from the patient's perspective. It's so obvious to me that we need to change a lot of how our care is delivered to patients. So I get to share my experience with these people who are planning change, and I think it's really vital to hear from patients.
I look forward to participating in more. My involvement as a whole has been invaluable to me. If I could leave you with something from me today, please let it be this. I believe. I believe in the work that we are doing, in the lean process, and I believe in everyone's ability to pioneer change. With remaining open-minded, working hard, and maintaining our focus and vision, we'll be able to provide our city and province with the health care it's asking for. It will not be easy, and it won't even be hard. It will be defeating and at times hopeless, but so rewarding and so worthwhile. So I want to thank you for your time today, but most of all, thank you for everything that you do and your team members day in and day out, because it is making a big difference.
Your leadership today and the work that you're undertaking day in, day out for this movement, the critical key point that I want to make is 20 years from now, you're going to be approached, and people will ask you about today and the days that preceded it and the days that follow it. They'll ask you what you were up to, and you'll say, patient and family-centered care. And then they're going to ask you a question. Who's at the center before you did all this work? Because it'll just be the way we do things. It'll be embedded in the culture because it'll be the way we do things. It'll be every day, every decision, at every level. That's the future. And if you think that this movement that doesn't have legs, remember those students. They're coming your way sometime very soon. Thank you very much.
I think we have time for a question or two. Okay. Any questions? Okay.
What is it with anybody approach you in that position, what you should do for them? Or did you listen to something like that?
Do you mean...
When you were in the assistant manager or very consistent?
When you were the CEO.
Yeah, so...
Could you tell us if anybody approached you when you were the assistant minister to change the health actions?
Yeah.
And
so
what was your opinion?
It needed change.
Yeah.
But it was also my experience. In part, as the chairperson of the Health Quality Council, we actually had to, if this were a 12-step program, step one, admit you got a problem. And you think that's not much of a step. That's a massive step. Because in order to move off the status quo, you have to understand and collectively agree that the status quo is no longer serving us well. One of the biggest failings that we've had as a country is to think, because of the pride that we have in Medicare, that we've got the best system in the world. The only reason, well, I'll tell you what, success breeds complacency. And what you need to do is always guard against the best program that just got implemented in thinking that you landed, because you never land. Constantly reinvigorating and redefining and redeveloping programs. It's continual improvement, right? So probably the biggest thing for me personally is a deep regret over the mistakes I made in the past. Yeah. So you look at it and you go, oh man, I mean, some of those budget decisions that were made were brutal. And the belief that while efficiency seems to be this thing, I can tell, and I hate the word lean, by the way, okay, because it just does nothing for you, right? It's just like, oh man, what is this, another thing? The beauty, though, of that approach is the patient is front and center. That's where you start. And that had all the components for me. So you're no longer reducing something. Only if you had the money, you'd add it right back. What you're doing is you're streamlining, supporting, improving. It may mean you have to make investments in certain areas and disinvestments in others. You guarantee that no one of our providers is going to be negatively affected. They're not going to lose their jobs. We have laid people off only to hire them right back. Why do we do this to people? You know, and that's the culture of the place. So I think there's a fundamental and paramount underpinning here that means a better place into the future.
Yeah, one more.
Oh, great. Thanks, Dan. I was pretty impressed with how you moved or spread innovation from the health sector to the education sector, moving from patient first to student first. But I'd like you to comment, and I know you've got some experience in trying to spread innovations across jurisdictions. I'm thinking of the work that you did leading the Innovation to Action initiative. Can you share with the group some of your observations, reflections on the difficulty of spreading innovation across Canada and how we can avoid reinventing the wheel from one jurisdiction to another?
So here's an interesting point, and it came out in spades throughout this conversation. What Bill is referring to is my work with on behalf of premiers across Canada with Healthcare Innovation Working Group. here's the theory. It actually comes from positive deviance and the work being done in that field. For every problem that you've encountered, someone's already solved it. Like we have a tendency in this country to go to Finland or go to wherever it happens to be. And I'm not saying be insular and don't go places, but if you think for a second that someone right here in Quebec, okay, or Montreal hasn't already solved the problem that you're trying to resolve, it's been done here, it's been done with the same constraints, the same environment, the same culture, the same issues. Now what you need to do is go to them and try to unpack it. Let's figure out what the preconditions were to success. I can guarantee you that the themes that start to emerge almost become a mental checklist to the changes that are required. One of the things, and it's a pet peeve of mine, is that we put a lot of development in certain levels of training and professionalism. But a manager you go from one day to being a manager like that. We provide you very little support. We throw you to the lion's den and let you float there. And then by experience, I mean, learn by doing is great, but you gotta learn, right? So we've got a lot of things to learn, but leadership is one key component. Articulation of vision is something that we need to put forward. And here's what I say on that, is I can say patient first is a far more enduring vision than budget first. You don't reflect on your deathbed and say, if I could have only saved another $1,000, it would have meant such a big difference. It's passion. It's speaking to the head and the heart. Someone said earlier today, it's why we got into healthcare. This inner drive. That's what the motivation is. That's why there's momentum around this movement.
There you go. Thank you.